As physical therapists, lower back pain is probably the most common thing that we're going to see in the clinic. But what happens when someone comes in and they have something that's not coming from the musculoskeletal system? Today, we're going to break down the most important lumbar red flags to ensure that you're screening and evaluating your patients appropriately and understanding when to refer. Let's dive into the subjective screening for patients with low back pain. As we discussed in the introduction, we see low back pain all of the time, but we want to make sure that we're not missing any of the red flags. So when you get to the time to ask particular questions, one of the things that you're going to want to ask is night pain. A lot of your patients, most of your patients will tell you that they do have night pain, but you want to dive a little bit deeper into that. If they wake up due to the pain, are they able to go back to sleep? If they're telling you the pain is constant, it's unrelenting, it's not changing with movement, they're not really able to go back to sleep, then that's going to raise your suspicion a little bit of a particular red flag. You want to ask about bowel and bladder function. Particular diagnoses that are related to red flags will indicate some type of abnormal response to bowel and bladder function, one of which is Cauda Equina, which we'll talk about. So particularly important questions you want to say, have you had any changes in using the restroom? Any difficulty starting or stopping going to the bathroom? That's going to be very important. You want to ask if there's any trauma that's recently occurred. Have you had any falls recently? Were you involved in any type of accidents? That can lead you to something like a fracture potentially. Any recent infections? Osteomyelitis potentially can be due to an infection that can spread to the spinal region. When thinking about lumbar red flags, what we can do is put them into buckets. So we'll come over here and we'll create some buckets. The first one is cancer. So typically for cancer, the number one biggest predictor for cancer in the lumbar spine is previous history of cancer. So that's going to be another question that you're going to want to ask the patient. So if they tell you yes, then that's going to automatically raise your suspicion. They're going to have an age greater than 50, typically. We talked about the night pain. And then something else that they may also have is unexplained weight loss. So if nothing's really changed as far as their activity or lifestyle, but they're losing weight, that should also raise your suspicion there. So again, this one, history of cancer, is going to be very important for this. Next, we'll come into potential fractures. What types of things may lead somebody to have a fracture? Well, we talked about it a little bit initially. Trauma will definitely be one. So any type of accident acutely is going to raise your suspicion. But you also want to think about other predisposing factors. Does somebody have poor bone mineral density? Are they osteoporotic, osteoporosis, or osteopenia? You may have somebody who's a little bit more elderly who had a low energy fall, and you find out that they have osteoporosis and they're presenting with low back pain. That may be something to have on your radar. Long-term corticosteroid use. So I'll put corticosteroids. So in this situation, we know that repetitive use of corticosteroids can decrease the quality of our tissue, and that may also lead to a fracture. The other one, which is very important in the lumbar spine, is pathology known as Cauda Equina. Cauda Equina. This is where we have some compression around our conus medullaris, around L1, L2. And this is something that is an immediate referral to neurosurgery. This is very, very important to refer. Typically with this is where that bowel and bladder is going to become very important. And the biggest predictor for this is urinary retention. And that's why it's important to ask the specifics of bowel and bladder. You may have a lot of patients that say they may have incontinence, like stress incontinence or functional incontinence, where they can't hold and they have to use the restroom. But specifically, are they having trouble with urinary retention? That's the biggest thing with that. You're also going to have saddle anesthesia, which is numbness around the saddle region. So you can ask them if where you would sit on a bike typically, are you having numbness, tingling in that area? And then you'll have some other lower motor neuron signs and symptoms that you'll want to look at as well. So to sum up what we looked at here, a couple of buckets for lumbar red flags. We have cancer, we have fractures, we have Cauda Equina. Our last of the buckets is infection. Patient walks into the office, they potentially may have fever, body aches or chills, typical signs and symptoms of an infection. Other things you may notice is if they're immunocompromised, so immunosuppression, or a history of IV drug use, which can cause an infection. Something we sometimes don't think of, especially if we're not highly suspicious of red flags, is our vital signs, heart rate, blood pressure, even looking at temperature. That's why it's important, especially if you have a patient who's just not feeling well and you see these cluster of symptoms. To overview what we talked about for our lumbar red flags, we have our different buckets here, going left to right: infection, Cauda Equina, fractures, and cancer. To other types of diagnoses that we make, we typically want to use these in clusters. We talked at first how night pain may be something that a lot of our patients do have, but we want to look at these other things. So if they have a history of cancer, if they have the night pain and unexplained weight loss, that cluster together is going to have you highly suspicious of that. So we want to use these things. Cauda Equina, if you're noticing these symptoms, the urinary retention, saddle anesthesia, those other lower motor neuron signs, it's definitely an immediate referral. So it's important to look at all these things together and ensure that you're referring appropriately.